I'm Dr. Angie Stamm.
And I'm Kayla McGuire.
And this is Integrative Connections, a wellness community for pets and people.
Welcome to Integrative Connections podcast. I'm Dr. Angie Stamm, and today we're here to interview Mark Kyle from PrepVet, stem cell company for pets. I've actually worked with Mark for over 10 years now in my clinic, treating dogs and cats with his stem cell product with great results. And I'm excited to share a little bit more about this product and how it can benefit your pets. So welcome, Mark. Thank you for being here. And I'd love to hear a little bit about how you got to your place in the company with PrepVet.
Well, first of all, I'm just really glad to be here and really get you guys going. I'm excited for your podcast. So good for you guys.
Thank you.
You know, it's crazy. I didn't realize it's been 10 years. Now you're really aging me. So here we go.
Yeah.
Okay, so let's talk stem cells. So how I got here, I used to have a company years ago that was on the human side that did things with blood derivatives. So blood derivatives, as you would know, would be albumin, immune globulin, and factor VIII and IX. And for the guys that don't know what that is, factor VIII and IX are for hemophilia. Immune globulin, they often use it in like chemotherapy. If you're getting all this chemo, they give you immune globulin to boost up your system. Now, albumin's used in a variety of different surgeries. It's called a blood expander. So when you're having heart surgery or something, or even like burn things, you actually lose volume. So it actually goes in, feels like you have more than you have to help you recover. So I've been in that business for a long time. And then I had a friend of mine had reached out to me with one of the leaders in the stem cell world, that they were able to get stem cells from blood. And because of my experience, they wanted me to bring me on because they wanted to launch a stem cell company here in the US. And the doctor's name was a guy by the name of Dr. Vasilius Paspalaris. He's well known. He's a pioneer in the stem cell world. And we're going to get into this in a bit, but what he'd been able to do is find stem cells that actually came out of blood, and which there's a lot of advantages, and I'll hold that for now. But anyways, fast forward, I get to hang out with you for the last 10 years and talk about cool things.
Great. Well, one of the things I really appreciate working with you is how accessible you are for questions. If I can text you, you get back to me right away. You've reached out to, I've had clients call you directly with questions, which is wonderful. So you've made it super accessible and easy for us to offer this product.
Well, thanks so much. You know, it's funny. I always tell people I drank the Kool-Aid a while ago. And so I just so believe in it. And I love talking to the pet owners. I really do, because it's such an advantage versus some other options out there. And it's not a perfect advantage for everybody. But I love to talk about it because, you know, if you're a pet owner, which I am, and, you know, we're both involved in the pet world, when you've got your child, your animal child, you want to get the best thing for it. So it's so great to talk to people. And then when they get treated, oftentimes I hear from them and they're so excited to tell you the story. So it's actually heartwarming.
Very, very cool. So there's a lot of different stem cell products out there, some of which are approved for humans and pets in this country, and some of which are not. And so I think for most people, it's very confusing to determine what product, what price point, and what are the different levels of efficacy and potency of the stuff. So can you kind of break that down for us?
Yeah, let me give you a little history of stem cells too. So now bring it forward. And after the reason why I'm going to give you that is that we're going to hear about those other technologies too. So in the mid 1800s is when stem cells, the name of stem cell actually came out. So and that happened then. And then in after, I think it was World War I or II, they started using bone marrow for radiation. So when they were bombing people in that, and they found out in bone marrow, there's a stem cell called immunopathic cell. So stem cells, the different cell than what I have, it's a cell that's in the blood that helps different things in there, that works for almost repairing red blood cells, white blood cells, and platelets, which aren't a cell, and I'll explain that later. They started using that, and then they started using them a few years, 10 years or 15 years later. We hear about bone marrow. A lot of us have heard about it for leukemia. So they were doing bone marrow transplants, and I think bone marrow transplants were late 1950s or so. And they actually were successful using that and starting to treat other disorders with that. Now, just to give a bone marrow 101. So in bone marrow, basically, I always tell people it's the kitchen for cells. You're making red blood cells, white blood cells, and also a bunch of different stem cells. So you're getting that in there. So think about it that. So when people were always talk about, like in leukemia, you want to see a bone marrow match, generally because it has to be with those things. So they're looking for a match in there. And what they're doing, because it's a blood disease, they're getting these cells to help repair or do whatever they can for cancer or something like that. But along with that, they're also getting stem cells, which is doing some other repairs. Okay. Then fast forward to 80s, and then we all, if you remember hearing about embryonic stem cells, so there was a big deal in the early 80s where they were talking about these cells and they were getting stem cells for embryos. So there were several problems with that. One was obviously the religious connotations. Everybody was flipping out over that, legitimately so at some level. The other issue is that embryonic stem cells, if you think about an embryo is trying to grow a being. And so these cells they have in there, they're actually trying to grow a being. So when they were actually working with it and using them, it was actually oftentimes they'd get these tumors, which are called a teratoma.
Okay.
What a teratoma is basically a tumor trying to be a being. So you'll see these weird pictures of like teeth and hair. It's really like in the old days in the grocery store, you see the National Enquirer. There would be teratomas there. This being, you're growing a being out there. So that was what was happening. Then you fast forward to the early 2000s. Two things were going on. They started getting stem cells from fat. The medical term is adipose. And when they were doing that, the cell they get, the medical term is called mesenchyme. But their stem cells all have different potencies, and it has a multi-potency level. And so they started doing that, and it's really good. I'm kind of bouncing around a little bit. It's really good for orthopedic things. And I'm going to get into more detail on that. I just want to give you the chronology. And in 2006, there's a guy by the name of a Japanese scientist by the name of Yamanaka. And he started doing this thing. So there's another term for a different kind of stem cells called induced pluripotent stem cells. So what he was doing, he was inducing cells to be a specific thing. He ended up getting a Nobel Prize because he was able to take these cells and have it make skin. So he was doing that. So when you see the acronym IPC, it's not exactly what we're talking about now, but a lot of it, there's a lot of science currently being done because they're inducing cells to be specific things. Now, a little bit on stem cells. So basically, stem cell is considered a master cell or repair cell. But everything in our body and in an animal's body has its own stem cell. So there's a cartilage stem cell, there's a kidney stem cell, there's a liver stem cell, there's nerve stem cells, and a variety of different things. So getting back to Yamanaka, he was actually inducing cells to be very specific to what every organ or tissue actually has. So he's doing that. But when you get to the cells from fat, they're not doing that because they're taking cells. So our bodies have a wealth or a plethora of cells that are generic and haven't been given a definition to say they are a skin cell or whatever. So when you look at the adipose technology, what they're doing is they're trying to activate these cells and then putting them in the body, these repair master cells. Then what they're doing is they're hunting down for anything that's broken, repairing it. So then what happens is that so stem cells have a thing that's called differentiation. They become something else. They also have another thing called proliferation. They self-renew. So what they're doing, let's say cartilage, they'll find a damage in their cartilage and start regenerating new stem cells that are actually cartilage cells to repair it. Okay, so now we get to the really good one, which is mine. So my technology. So with the problem with first of all, let me just step back just a little bit. So the adipose cells when you talk about potencies, they're considered multipotent. It's a great cell for like one or two different disorders. It works on some of the other ones, but not as well as when you get to my technology. And I always use an analogy, and I really do think it's a good technology. Stuff from the fat is a good technology.
And the adipose would be more your injury, musculoskeletal conditions.
It's mainly orthopedic is best for that. But when I talk about analogies, what I look at that is use phones. So back in the days when we used the flip phone, worked perfectly when we got it. It was awesome. You know, you can text with it, but it's a challenge. Now, if you move forward to where we're going to talk about mine, where you get the stem cells from blood, it's more like a smartphone. It's easier to do. It's easier to use. If we have to text, we can do what we're doing now, and we can do other things with it. Okay, so when you look at mine, when you look at mine, we're getting stem cells from blood. So back to the fat, what we're doing is you have to do a minor surgery. When you're doing surgery, generally that means anesthesia to harvest this fat to send off to a lab to get these cells. So now if you look at my technology, we use the term minimally invasive. You do a blood draw. And when you do this blood draw, the way we do is we isolate these very small, I'm going to use the embryo now, embryonic-like stem cell. The difference between an embryonic stem cell and embryonic-like is this. So before a being is born, they have embryonic stem cells or whatever, but the minute you're born, stem cells are now considered, even though it's the minute you're born, an adult stem cell. But it's not an embryonic stem cell. It's not going to grow these tumors and all these other crazy things. It doesn't cause cancer, nothing like that. So the cells we get are embryonic-like, and what they mean by that is ours will work with a variety of different disorders, kidney disease, liver disease, and a bunch of different things. And we can get into whatever you want to ask about that. So what we do, we isolate these cells that are more potent, so they're considered pluripotent in nature. So you've got the fat and the bone marrow, they're multipotent. So they do really good in certain things, but not across the board. Now, ours doesn't go across the board, but it goes across much bigger variety than disorders we treat. So it's pluripotent in nature, and it just does more, and it's just easier, less stress on the animal. It's easier to do, so it's easier for the veterinarian to do. And the great thing about this is, because one of the things you're talking about, I feel like I'm slipping down the same, I keep slipping out my chair. What we do, it's great in humans too. So it works in humans. So across the board, as a matter of fact, and we can talk about this later, we're in the process of putting together a clinic down in Mexico because we can't do it here in the US. We can get into that. Anyways, long story short, you do a blood draw from ours. We combine ours with platelets. Now, a platelet is not a cell. And the way I always explain a platelet's kind of like a water balloon. In that water balloon, if I was to burst that water balloon, there's like 35 different proteins, which are also called healing factors or growth factors. One of the big things in there are anti-inflammatory. So when you're feeling bad, generally when a dog's feeling bad or we're feeling bad, a lot of it has to do with inflammation. So what we do is we combine the stem cells with the platelets, which is where our name PrEP, and PrEP stands for platelet-rich, enhanced with stem cells plasma. So you'll hear a term out there if you're looking for it, PRP, and that means platelet-rich plasma. Basically what that is, it's platelets that are multiplied 8 to 16 times. So when they say rich, it's that much more than you'd have normally in your body. Now, what we do, which is different with a lot of people, we actually burst that balloon, it's called laceating, and we combine the stem cells with all these proteins. So they're getting anti-inflammatory, some healing factors, but there's some theory out there that if you combine the PRP with all these factors, helps activate the cells to do more things. So that's what we're doing with ours. But when we treat all kinds of different things, and I can talk forever, but I'm going to let you ask me some questions because I'll probably open the door for hopefully an answer that I can answer. So we'll see.
Yeah, no, that's great. So just to walk our listeners through kind of what the process for pets look like, just to give a quick summary. What we do is we draw the patient's blood. We need a fairly large volume, somewhere between 50 and 100 milliliters of blood for a dog or cat, and then more like 200 or 500 from a horse, right?
It's about 450 ml for a horse. And on the human side, it's 250 ml.
Okay. And we mail that, we overnight that to you on ice. You do the preparation, you overnight it back to us. and we inject it either intravenously or locally, depending on the condition. Sometimes it's often a combination of those two ways that we apply it. And then sometimes we get a bonus vial of PRP. And so we freeze that, especially for orthopedic conditions, we freeze that PRP, and then we'll do that. I typically will do that injection a month or so from the initial stem cell application. And then from, my experience, usually one treatment is sufficient. We can certainly do a booster treatment in a year, once a year, but it's usually a one and done type of treatment.
Right.
Yeah.
So let me give you a couple things. I love talking about this. So I've done it 3 times for myself.
For yourself.
And yeah, because so I always tell people we're cars, right? I mean, my car's got a lot of miles on it. So there's a lot of things wearing down. And what's interesting for me, so I couldn't wait to do it the first time because I figured, oh man, I feel like a super farmer running around and doing all these things. What was crazy for me was, again, I have a lot of miles on my car. So what was crazy for me is I was actually out of the country when I did it. We can't do it in the US, and we can get into that. I was out of the country when I did it, and I was really traveling. So I was actually traveling around the world when I was doing this thing. But the first time I noticed a subtle difference, and I only did IV. I didn't target. I had a lot of sports injuries, so I didn't target specific joints. But I noticed a subtle difference. I certainly felt better, had more energy, etc. But not a major difference. Second time I did it was roughly a year or so after. And I noticed a bigger difference. Third time I did it, again, this is for the human side. The third time I did it was amazing. And it was again about a year and a half after that. Where it was amazing for me was my mental clarity. It was like I'm walking around in a car with a dirty windshield. I got more done for about 6 months. I was able to focus more and do all kinds of things. But here's my theory. My theory is that the first time, again, years and miles of damage that I have are just wearing out parts. That what I did was kind of like when you see these IV places. So for anybody that doesn't know, basically it was a bag and they put all the stem cells in and put in your vein system is your roadway to everything. So it goes in there and did that. I believe the first time it was repairing it, but there was a lot of damage there. It was just wear and tear. The second time there was less damage because I repaired that. The third time I had less damage and I had a better result. Again, this is Mark Kyle quack science, but I absolutely think that's the case. So when I've treated some animals, generally when we're never 100% fixing anything. We're reversing whatever the disorder is. We treat a bunch of different things. So like anything, one of the big things we treat is arthritis. We're going to generally get really good results about a year and a half on the low end. Actually, the low end could be less. We all heal differently, but a year and a half, probably on average. Sometimes it's 3 years of never being treated again. But I have treated, like American Bulldogs is a great example. I've treated this one dog in particular like 3 different times. And I've got video of this dog, as bulldogs are really notorious for having really bad joints in that. You see this poor guy walking into the clinic, and then when he comes for his checkup, he's like this new dog. And then about a year and a half later, he was walking in again, a little bit better. When he walked out that time, of course, I believe in everything too. So I'm wishful thinking. I'm positive that dog was better the second time. So, we're looking a year and a half later when he got treated again, it was even better for that. It was just unbelievable difference. Again, it could be wishful thinking. I don't want to have anything that's out there, but I really do think that dog was better. So I do think that they can only do so much, and hopefully they're doing that. But if there's a lot of wear and tear, a lot of mileage on the car, we're fixing that, and down the road, you may want to do it a year and a half later, something like that.
Is there an advantage to treating sooner than a year post?
Yeah, sure. I mean, again, if you think about my story, and because the advantage is that if I did it, let's say I did it once and I did it every 6 months, hypothetically. Obviously, especially if you're an older, worn-out car like I am, I'm old jalopy. That's what I am. So what you're doing is you're repairing that thing because everything wears out. I mean, we are machines. So if you think about that, you're just repairing sooner. So they're definitely going to do that. And so, sure. In general, for me, doing it every year made sense.
Sure.
But yeah, I can see an advantage. I'm not telling people that they should, but I can certainly see that there's an advantage to doing that.
Okay. Your general recommendation is going to be retreat every 12 months, but finances, allowing
Okay.
to be wrong. There's no harm doing it more frequently.
Right, exactly.
Kind of limited to finances, really.
Yeah, and the cool thing about it is, and for everybody that's listening, it is covered by most of pet insurance.
Yep.
And by the way, and I don't work for a pet insurance company. I highly recommend it, regardless if you're doing stem cells, because it's so inexpensive. It's not like human pet insurance. Pet insurance is so much different. It's so inexpensive, and for anybody that's really taking care of their pet, it's a great thing to have. I just recommend it anyway.
I agree, and I try to be the difference. One of the main differences with pet versus human insurance is that pet insurances will exclude any pre-existing conditions. So go back through your medical record, your vet records, and if the dog already has a history of arthritis or tendon ligament injury or whatever disease condition you're treating, they're not going to cover that. So if you can get the insurance when the pet's young and healthy, that's the best time. And then just hold the policy and make sure you choose the right company, because if you try to switch companies later, then they're going to go back and look at any pre-existing conditions again.
Right, exactly.
So but I have had several clients with insurance that paid out on the stem cells, which is great. So yeah, I think that's great.
Should we talk about all the disorders that we treat?
Yeah, I think that would be great.
Yeah, so for you guys listening, first off, there's all kinds of studies done on the fat technology, the bone marrow technology. And by the way, the bone marrow is generally used for the most part with equine horses. They're using that because they'll either get it from the hip or they'll get it from the sternum. And that's just a common thing. And I want to address that here in a second. I'll get to the equine if we have time. But so on the fat one and for our technology, if you're treating anything orthopedic, there's all kinds of studies that are 100%, I would say, generally 95 or higher percentile that you're going to have a good result, either technology, for sure. Now, the advantage of ours, again, so when you're talking about the fat, which is adipose, and you compare it to what we get from the blood, the V cells versus these multipotent cells, we treat a lot of different things. Kidney disease, we've had great success with. Liver disease, we've had great success with. One that I really want to bring out, we treat a lot of neural disorders. So you have wobblers, degenerative myelopathy, which for humans would be ALS or Lou Gehrig's disease. We've treated that with great success, but great success is a different percentage. On average, 70 to 75% of the time we see results. And that sounds low, but there's no other options out there when you're dealing with a neural disorder. And we really have had it. So anybody that's suffering it, why wouldn't you do it? Because it really has worked numerous times. Now let's talk about percentages of success. I want to compare it. So if you, Angie, and me both have a knee surgery, same injury that we have, same doctor, more than likely one of us is going to have a better result than the other. Our bodies heal differently. So I always want to have a precursor to anybody that's out there that's treating. You may not always get the exact result you want because everybody heals differently. I can tell you it's a great option, but it's not 100% guaranteed at the end of the day. If there's any negative to stem cell therapy, I would say it's not 100% guaranteed, but it's absolutely the first choice, in my opinion, to always do.
Okay. So really, and there's no, like you mentioned before, there's no contraindication to this treatment.
No.
It's even cancer. If you have a patient who's got arthritis and cancer, it's not going to potentiate the cancer cells. That's a comment that I get from clients.
Not at all. That's a misnomer. And if you probably find some stuff out there that people are talking about, but it's absolutely not the case whatsoever. The only adverse reaction I've ever had with these things is that if somebody is treating an animal with arthritis, well, oftentimes, if they are not doing, when we're treating something a certain way, it's considered a protocol for your listeners that aren't vets. But so what they'll do is they'll inject it to the joint. And there's a term called periarticular, which just means, anytime you hear peri, it means peripheral. So It's just on the outside of the joint, but oftentimes we have vets that have been injecting in joints. They flare up their arthritis and have some problems there, and they don't need to do it. So that's just not in the right protocol. But they just go on the outside of the joints, the cells, I'll get into the science of that if we want to, migrate to the damage. And that's the only adverse reaction to date with thousands of animals we treated we've ever had. So knock on wood, but we've never had any adverse reaction. And that was really the guy doing it versus the technology itself.
So that actually is a good point for any veterinarians listening who are interested in offering this therapy, is if they're not confident in doing joint injections, but they want to treat arthritis, it's actually preferable to
Right.
do periarticular injection as long as you're in the general vicinity, and that's
Exactly.
actually better than going
Right.
into the joint capsule.
Absolutely. So let me just talk a little science out there, and for the guys that aren't vets, hang in there with me. So there's a parathyroid hormone and there's a parathyroid hormone receptor. So I want you to think about it as kind of like a lighthouse in a boat. Okay, so when we have damage, there's this lighthouse out there that's saying, hey, there's damage here, there's damage here, there's damage here. And the boat says, okay, here's where I need to go. It's give me a direction to do that. So when we have something that's not working properly, the lighthouse is saying, come to me, I got some problems. So when we do this periarticular, this peripheral outside of it, these cells will actually home in because they now have this lighthouse that's down where it is, go there and actually, the crazy thing about this is, to go back a little bit on this, they go there, they go to this damage, and it causes whatever that is. Let's just say it's a ligament. It'll go there, and it will actually start, the ligament will actually start making more ligament stem cells. This is going there saying, hey guys, there's a problem here, and it's called proliferation, and it starts growing all these other new stem cells that are really designated for what that is. It's this really cool thing.
That's great.
Fun.
And then when we get your kits back from you, you'll have you'll have the stem cell vials.
Right.
And you'll have a little vial that's called nano. And that's,
Right.
You've taught me that if you're treating a local area, not just doing a systemic treatment intravenously, you'll actually inject that product into the area that you're treating at first, and that will attract the stem cells to that area. So can you talk about a little bit about what's in that
Sure.
nano vial?
Yeah, good. Great. So for the vets that are listening, and even for you guys that are listeners, so what happens is we get this blood to our lab. And then what we do, think of it as like a cake. In a cake, you've got sugar, flour, and all the other stuff. So what we're doing is we're taking out of the blood the components that we want, that are really what we want to do to make them work. So we isolate the stem cells. We also get the platelets. And so when we get the cells, by doing that in the process that we're doing, we're waking up. So think of it like you have two kids. They're both really, really smart, but one's an A student, one's a C. Why is that? The C student's not doing his homework. What we're doing is we're taking these cells, we're kind of slapping around and saying, go do your homework, you're an A student. So what we're doing is tell these cells, okay, go do your job. And so what we do, we combine them with the platelets or the PRP, we put it together, and then what we do is when we send it back to the clinic, if we have an extra volume to send them PRP, like you mentioned, we send an extra vial of that, and that's for later. But then what we do is we send you vials that are combined, or vials that are combined stem cells and PRP. That's where the prep thing comes from. We also send you a small vial, and it's only specifically for joints, nano. And what that nano is, it's a nanotechnology that's actually for the doctors out there. It's a scaffold. So in other words, it's to hold the cell in that general area because they're very small. For you guys that are listening that don't know that, think of it as Velcro. It's kind of like a Velcro that's going to attach to the thing. There, a scaffold would be like, or even a stucco. When you have the wire there, and you put the stucco on, it holds it there. So this it's a nanotechnology that's very similar to disposable sutures. So basically, your body absorbs it and it goes away once it's attached, and your body just absorbs, kind of like lactic acid, a little bit like that. That's what it's doing. So we send you something for the joint specifically, and the rest is for doing, if we're targeting an area, or just doing an IV injection.
Okay, that's great. Super helpful.
I actually sound like I know what I'm talking about today. Good.
You've been doing it a few years.
Yeah, once or twice.
So you have veterinarians all over the US that are offering this
Yeah.
to patients.
And some out of the country as well.
Great, great. And so other countries, you can ship international as well.
I'm only doing Canada right now, although I don't know what's going on right now. Things are going, but I haven't done it. I haven't heard from them, so I'm kind of curious how that works. But yeah, I've done Canada as well.
Okay, great. Let's talk about adjunctive therapies. For me,
Yeah.
my integrative practice, I do a lot of prolotherapy, which is an injection technique to create microtrauma to stimulate a healing response. It actually is known to recruit endogenous or the body's own stem cells. So when I'm treating arthritis or tendon ligament injuries, I tend to combine prolotherapy with your stem cells.
Sure, why not?
Some really great results with that. So I don't see,
Yeah, exactly.
And even ozone is known to recruit stem cells and provide oxygenation.
Oxygenation is healing too.
Yeah, so I don't know if there's been any studies looking at potentiation of the stem cell therapy with other adjunctive therapies.
They have, and you do laser therapy. So, one thing we should actually, let me just sidestep for 1 second before we come back to it. One of the protocols that we do, and I know that you guys do that, is that when we're treating the animals, whatever the disorder it is, if you're a vet that does acupuncture, part of our protocol therapy is actually injecting in the meridians that are associated with whatever you're treating. And so similar to B12, the same amount of volume you do there. And there's a lot of, we've seen great results with it. If you don't do it, it's fine. But obviously, if you do it, I think it does add, it's a little bit added to that.
Great. So, and I've done that as well. You've told me to do that.
Yeah, exactly.
That's great.
Here's a crazy, let me tell you a real quick story because I love stories. So anyways, I've treated now several animals. I treat in other words, I work with somebody who's treating animals with kidney disease. Now, for you guys who are acupuncture, you're going to understand this. And what happens is when they've done that, they inject the meridian points that are affected with the kidney. Not only did we get great results with the kidney, but these dogs, several of these dogs were older and their hearing improved. Because that meridian is affected with your ears. Now, I can't test them, but I can tell you, I've heard it so many times that I know for a fact they're going, actually, Fido is now responding when I call them because they can hear. Craziest thing ever.
Well, the ears are associated with the kidney meridian.
Yeah, it's kind of cool.
That's great. And so,
we're talking about adjunctive therapies.
Adjunctive, yeah.
Yeah. So one of the things, there's a lot of information on laser therapy too, and I know you guys do that. Two things, if you guys are listening. One of the things we recommend, first of all, laser therapy does create more proliferation of stem cells. There's some science out there that does that. It doesn't do what we're doing, but it actually generates more of that. If you're treating stem cells,
and are you talking about class 4 laser or low level laser?
Low level.
Photobiomodulation type laser.
Exactly.
Got it.
So if you're doing, if it's the normal practice, you've got a dog and you're doing it now, and you end up doing stem cells, we recommend waiting at least 2 weeks, if not longer. But with a preference, if a dog just needs it, then do it. But there's some theory out there that it actually inhibits what we're doing if they do it. It doesn't hurt it, but it slows it down the process. So it's better to wait a couple of weeks to let the stem cells start doing their proliferation and things like that, and then go ahead and do it. Then wait a couple of weeks after
that. Got it. Circling back to the kidney patients, you're primarily going to do that as an IV infusion, intravenous infusion of the stem cell.
2 things.
And so when you're perirenal as well.
Right, exactly.
Okay. So just like the joint, you're not going into the kidney, but you're kind of injecting it into the epaxial muscles over right? In that or acupuncture points associated with the kidneys.
Exactly. And so for the people that are just listening out there, so we use this term perirenal. Remember what I said earlier, peri means peripheral. So if you have an animal that's got kidney disease, whether it be cat or the dog, what we're going to do, generally, we're going to recommend you inject just on the outside of the kidney, there's 2 kidneys on either side, inject there. They'll do the acupuncture points if the vet does that, and then they'll do an IV injection with a bag with all the stem cells again. going down a roadway to figure out where all the damage is.
Great, great. So you mentioned, of course, the orthopedic, arthritis, tendon ligament injuries.
Mm-hmm.
We talked about kidney, liver disease. We've talked about neurodegenerative conditions.
Mm-hmm.
What about what other common conditions are you having success with?
Okay, one thing on orthopedics, so I want to tell everybody, if you have a ligament that's full turned, the stem cells aren't going to repair a full tear.
Right.
Partial tear for sure, and oftentimes too, if you even had a full tear and you have a repair, I really recommend. Of course, it's my deal, but I would recommend doing stem cells too because it's going to really accelerate the healing process. So we've done a lot of a lot of dogs have had surgery, a lot of horses like superficial tendons and things like that we've treated and had really, really great results. So back to your question. So atopy is really atopic dermatitis we've treated regularly.
And you said that would be obviously an intravenous infusion for allergies.
Right.
Right. And what do you think the mechanism is for that is with the stem cells? Is that's doing how is that? How do the stem cells treat the allergies? It's probably working to some degree on obviously regulating the immune system, repairing the gut barrier, I would imagine.
Yeah. Plenty damage done through that, and generally it's slowing down the autoimmune system, basically. So it's slowing it down and doing that. Now, what we found sometimes when we're doing atopy, sometimes we have to treat twice. Sometimes we don't get a good result after 60 days, and we'll treat again.
Okay.
And it doesn't always. It's not the first. We do get that all the time. I'm trying to think. There's so many disorders we've been treating. We've been treating all kinds of things that I hadn't treated before. So what's amazing about this technology is we're finding more and more things and developing different protocols for all kinds of disorders there. And for anybody listening, the doctor are there. It's not a miracle cure. So I'm not the guy that's going to say it works all the time. What I would recommend is, and occasionally somebody will have something that I haven't treated before, let's try it. But it's certainly a better option than using steroids or surgery and all that kind of stuff too. So I'm open to trying things too. If it's some really oddball thing, more than likely for you guys who are listening, I will probably donate it to come up with a protocol with you.
Nice. That's awesome.
Yeah.
And what about cognitive decline? It sounds like it worked for you.
That's a relative term.
You said your brain was clear.
Yeah. No, but with me, we're talking about me. For everybody else, absolutely. Actually, heart disease as well too.
Cardiac.
Yeah, absolutely. Heart disease.
Type?
Positively.
Mitral, even valve disease.
Yeah, any damage at all, because when you're doing IV, it's going right through there, it's filtering through that. What's cool about these cells too, and I'm going to get a little bit more science of brain barrier, right? These cells are small to go through the brain barrier, so you're actually doing better than the other one. Now, and I'm always cautious to talk negative about technologies, but when you hear, one of the things you're going to hear out there when you're talking about the fat technology, and for the doctors adipose, you always hear one of the things with our technology, we're usually treating with, and I'm going to give you numbers, like roughly on average, somewhere between 1 million to 1.2 million cells. Now, if you've ever heard anybody else talk about the other technology, the fat, which are mesenchyme multipotent cells, you're going to hear tens of millions of cells. And that's really in my opinion, is a marketing thing. Again, it works really well with orthopedic. When you hear it, and if I think about it, if you don't know, and you're a patient, well, if I can get 1 million or 10 million, what am I going to get? I want the 10 million. Well, the difference is that, think about it, we're getting the cells from the blood, we're re-injecting them back in the blood, where they're staying in their environment. But if you take cells from fat, and you isolate these cells and you put them back, and their protocols are going to be very similar to ours. You put them into an environment they're not used to being in. Their viability are the ones that are actually still around active go down significantly. So the viability goes down. So when you hear 10 million, they're getting it, but what really is getting in the body and actually is active, that number is significantly less than what we started. Again,
Sure.
I think it's a good technology, but just remember when you hear 10
not
million,
the
or it's not necessarily mean it's 10 million.
Got it.
Yeah.
It's sort of like the same concept of bioavailability of supplements, right? You might be taking
Right.
1,000 milligrams of vitamin C, but how much is your body actually absorbing and utilizing?
Exactly.
Yeah.
Same thing.
Yeah. Can you talk a little bit about your challenges in getting the FDA approval for your product in humans?
Yeah, let's do that. One thing I want to talk about real quickly before we do that, I just thought about what we were talking. So in the horse industry and in some other, if some people are doing, sometimes what you'll hear about people getting stem cells, often from blood, from the bone marrow, and they're going to actually grow more stem cells. You're going to hear people, oh yeah, we're going to take them, we're going to send you back more stem cells. When they do that, the problem with that is it's called expansion. They're expanding more cells. Second generation cells are bigger, but they're not as good as the first generation cells. When you hear that, again, that doesn't mean they're bad, but they're just not as good as your first generation. So if you're having to do expansion, the results are probably not always going to be as good as you'd like it.
Okay,
So that's the case.
back to the bioavailability.
Exactly.
Example.
Yeah. I mean, it's a great idea. And one of the things, like I talked about, I'm going to answer your question on the FDA too, because one of the reasons why we're opening a human clinic down in Mexico is because we can. But a lot of the people down there are they're getting their cells from people that are getting umbilical cords, and they're expanding these cells to do that. So they're just not as good. I mean, bottom line, again, my opinion. So FDA. So here, a little bit backstory of mine. So when I was getting started with this thing, the main reason I was getting started was really for the human side. Because this works great for the human side. I mean, it took 3 times for me to get my cognitive skills back up. But anyways, the plan was to do it for the human side, and it's just not coming along. So and again, this is my opinion. And I'm not bad-mouthing anybody, but this is my opinion. I'm opinionated. So one of the problems with the FDA is their claim is that this hasn't been around long enough. My opinion is that stem cells today, and I think we will see it in the future, cannot be mass produced. So a traditional pharmaceutical company can't mass produce these and make it a business. So the FDA is moving slower because they don't have the money behind it to get it to go. And so what's crazy, again, for your listeners, is that stem cells really started being used in humans before they were for animals. Typically, when we hear from we're being treated, it's actually on the animals first and then the humans there. The advantage of it, though, is I think, which is great about this. So if you go into the human world, everybody's always heard phase 1. They go through all these phase gazillion trials. It takes years to get it there, millions and millions of dollars, right? So on the other side, if you're in the animal world, we're now finding out what it's working before the humans are being able to find out it works. But if you do a trial in the animal world, it could be 6 animals versus thousands. You're actually doing that because obviously they're animals and we're not looking at it as being. But what they're doing for us is really giving it a door open that we're going to go, wow, it's working here. Now let's figure out what it works in. We're really not using it as guinea pigs, but they're actually getting the benefits of it before we are. But still, it's really going to open the door for us to treat a lot of different on the road.
Yeah, I'm excited about your Mexico clinic.
Me too.
Yeah, I'm going to come down and get treated.
Yeah.
So how can pet owners find a veterinarian that offers your service, your product?
Okay, so we're across the country. So what I tell people, and they can all, put it in the description, but you can get a hold of me. I'll work with any veterinarians. The great thing is, this, is that when you get started with this, because it's so minimally invasive, it's a real easy thing to do for the most part once you understand it. So I'll work with your vet. One of the things that I love about this technology is that because it's minimally invasive, and most animals don't like going to the vet because they get scared. And so you want to take that stress level down, right? So if we can just do it, so when we get back to the process, like you were talking, so if you have a vet, you're a vet out there, I can work with any vet and give them the protocol. But if there's a vet out there, I'll work with anybody and walk them through that. If you're a pet owner, I'll talk to your vet as we talked about. I talk to all of them, or I'll know somebody, hopefully know somebody in your area. Here's the crazy thing. So your dog, you bring in your dog, cat, or whatever, you bring him into the vet in the morning on a Monday, you have them do a blood draw, you're there for less than a half an hour, generally if it's scheduled at the right time, they do the blood draw, you go home. You bring your dog with you. Typically what we do is we have a 48-hour turnaround. So what happens is the vet will ship it off to us, our lab will receive it the following day, we'll process, we ship it out for the next day. Now, a lot of vets will actually wait a day because if there's a shipping problem, we don't want you to have to come in. Then what's so great about it is, you can think about the stress of your animal, then a blood draw, no big deal. You come in and the protocols for the most part, except for some of the kidneys or the liver, or if we're doing neuro, which is a whole different thing, is very easy for them to do. So you can be in and out the second time within an hour or two. So you're in and out, if the dogs aren't feeling stressed out, it's a pretty easy deal. So it's a real stress, not stress-free, but stress-less way to do things. Since you don't want these guys to go through this major stress thing, but really helps them too.
Yeah, generally speaking, in my experience, we don't need to sedate the patients for the initial blood draw, but I typically will do a light reversible sedation for the injections, especially especially if you're treating joint areas and combining it with prolotherapy or something like that. But even for the IV infusion, it's nice to just have them relaxed and still for that.
They're settled down. And yeah, that's right. And I know that there are a lot of vets out there who do that, or if they've got an anxious pet, then they'll certainly do that for sure. The other thing is too, is for you, the pet owner, and for the vet, once we process it, and we recommend that you treat them within 14 days. So the viability, as long as you have it in a refrigerated, not frozen, it's refrigerated, then you've got a 14-day window where you can treat them. And so for you too, if your dog is really stressful, you've gone to the vet and you don't want to take him back in 48 hours, you can do that as well. So you can take the stress level out on that too. So you've got a 2-week window to actually treat him once we process it.
That's great. And then circling back to the insurance coverage on your product, have you found that insurance will only cover it for certain conditions, or will they cover it for these,
across the board? I've never had that issue.
Kidneys, never had an issue with,
No.
conditions.
Well, here's the other thing too, and for the insurance companies out there, let's close your ears. But what I often find is when you're treating an older dog, and let's say they have a preconditioned joint, this happens, I recommend this to a lot of people anyways. If we're treating, as an example, they've got a kidney disorder, they also have joint disorder. So they may have already had on your records of joints. You can file a claim for kidneys and also treat the joints at the same time. So you can do a lot of other things. So if they're older in particular, even if they're 6 years older or up, generally there's some other things going on that haven't been treated before.
Sure.
You can put that under the insurance, and actually, because we'll send them, if they're not treating joints, unless we're asked for it, we don't send them nano, but we'll send that for whatever. Go back to the extra PRP. We do that. I always call it dessert with a meal. If we can send it, we'll send it. And PRP the effect that you get tends to last anywhere from 40 to 60 days. And I always I call it the PRP effect. That's my term. But what's crazy about it oftentimes when you treat these guys, because the inflammation is really hurting them, they turn into puppies again. You have to slow them down because they'll hurt themselves because they don't have the muscle. They don't have that core strength to do it. They get a puppy effect from it too. They just feel like puppies.
Great. Well, we're running out of time, but is there anything else that you want to touch on before we wrap up?
Let me think. I guess I would tell anybody that's listening is that, again, I am available to talk to anybody that's here anytime to talk about it, regardless if you're going to do it or not. But if you just have questions to talk about it and just want to know, again, like I said, I drink the Kool-Aid. Matter of fact, every bar I go into, I put my number, so please call me about stem cells. No, I'm kidding. But seriously, I love talking about it because the results I've seen have just been so positive that
And
it's
there's really
been really great.
really no downside.
No, that's the advantage of it too, is that there is no downside. If there are any negatives out there, it's economics, which, to be fair, or there are times for some random thing that we don't get a positive result. And I'm not a used car salesman. If anybody ever wants to contact me, just wants to be more informed about it, I'm happy to talk to anybody. And if I don't think it's going to work too, I'll tell you that I'm not out there trying to push this, other than just saying it's a great option if you're looking.
Great. Well, you're
The last thing we need to talk about, my podcast.
Oh, yeah.
About that.
Yes.
I didn't want to promote it, but for you guys, Angie's been on my podcast, by the way, you guys. So I have a podcast. It's all animals, but it's not. I do talk about new technology, but if you're just an animal lover, I do have a podcast, and it's called For Real, FURREAL. The For Real podcast is on everything.
And you just got voted top podcast in Austin.
Yeah, I got that. Yeah, we're getting there. But you know what? The reason why we got voted that, Angie's part of that reason. It's all about the guests and the people that I've had on. I've become friends with the people that are on there, but the guests, I've just been really, really blessed to have some really amazing people on that really made it better. Really did it better.
Well, great. We appreciate that. And I really just, again, appreciate how accessible you are to the veterinarians and clients about the stem cell therapy, and really makes a huge difference in our confidence, in the ability to treat the animals. So. Well,
really, truly, and I mean this, I love talking to anybody, but there are some vets that are some of my favorite, and I'm always happy to talk to you guys. It really is. And for you guys that are in that area, you got to go check her out. They're a great vet. They really are. I mean that, Jim.
Thanks, Mark. Appreciate that.
Well, thank you so much. It's been fun
being here with us, and it's great chatting with you. And I'm sure we'll talk again soon.
Yeah, absolutely. And just one last thing. It's fun to be on the other side this time. I had the other role last time, so this time back at you.
All right, Mark.
Thanks so much. Have a great day.
Bye-bye.
Bye.